welcome back to Metplex and Chill. This is your host, Rachel Gregory, and I'm here with Dr. Jaime Seeman. What's up, Jaime? How are you?
Hey, I'm good. It's so good to be back.
I know we were talking off air that it's been way too long. I think this is your third appearance on the show. The last two episodes, I think you were in one of the first episodes I released like 2 years ago when the podcast came out, over 2 years ago. And then we had you back on, of course. So I'm excited to chat today. Do you want to, I know we talked off air, we're going to dive into one specific question that we've both been getting lately about diet and nutrition, specifically for post-menopausal and postmenopausal women, and kind of how and if that changes, especially as it relates to tailoring it towards body composition changes. That's something that I've gotten a lot of questions about. So maybe we can tackle that one first. And then I definitely want to just dive into, your competition. You're about 2 months out from it. So I want to kind of talk about all the things and get your experience with that. So
yeah.
Good with that?
This is a common topic that, I get questions about on social media. And I think, every single woman listening has either gone through menopause or is going to go through menopause. So this really applies to every single woman listening. And for men listening, there's a woman in your life, and you staying tuned in will be helpful too at kind of understanding this crazy, crazy time in a woman's life. So basically, when women are born, they have ovaries that have eggs in them. And at what we call menarche is when the pituitary gland starts stimulating that ovary to develop oocytes or eggs, essentially, and release one of those every single month. So in a girl that has kind of come into maturity of her fertility years, every single month, pituitary gland is stimulating the ovary. And it's actually stimulating more than one egg. It's stimulating multiple follicles. It's kind of saying, hey, who wants to come to the party? And typically one of them will become dominant, and the ovary makes a cyst, which is kind of a myth out there that people think cysts on the ovaries are always pathologic. They're not. They're physiologic every single month. And then this egg gets released. And then if it doesn't get fertilized, then you have a period. But after the egg releases, that cyst turns into something called a corpus luteum. And so when you're in these years of fertility, you have different phases. So what we call follicular phase and luteal phase. And there's different hormones that are secreted in those two phases. And those two hormones have lots of different physiologic impacts on the body. And as a woman goes through her lifetime, the pool of eggs or oocytes starts to decrease. And we believe that a woman is born with all the eggs she'll ever have in a lifetime. That was kind of the working theory. Now we're actually kind of understanding that the ovaries might contain stem cells, and that you might be able to actually make more eggs in your lifetime, which is really, really cool to discover, right? Because I deal with women who have infertility related to not having premature ovarian failure. So that's kind of interesting to think about. And I've also heard people in the ketogenic space who say they went through menopause and then they went keto and started menstruating again. So it kind of makes you wonder, right? Yeah. We don't have any evidence for that, but it is a great diet for fertility. And I've seen some oops pregnancies related to that. But essentially, then a woman starts to get closer and closer to menopause. Average age in the United States between 51 and 52. And what's happening is every single month, the pituitary gland is trying to stimulate this ovary, and it's not getting good production of these oocytes, and the estrogen production starts to be very erratic. And not every single month might she ovulate. There might be some months where she doesn't ovulate, and that doesn't trigger this normal cycle of estrogen and progesterone. So the periods might become irregular. The periods might spread out or get closer together. These are very normal signs that you're in perimenopause. Now, if we were to check biochemically, a lot of women will come in and say, oh my gosh, I need you to check my hormones. The hard part about checking hormones is that hormones are different in the morning than they are at night. In a menstruating woman, they're different every single day of the cycle. In a perimenopausal woman, it's like trying to catch a fish with your hands. It's one day it's high and then it's low and then it's high and then it's low, or month to month. It might look like she's in menopause, and then the next month she's ovulating again. So it's very, very, very erratic, and it's very difficult to test hormones in the perimenopausal stage. But if we were to draw it out on a graph month to month to month, year to year to year, we're seeing a gradual decline in estrogen production and a gradual decline in progesterone production. And then eventually, the clinical definition of menopause is when you have not had a menstrual cycle in 12 months. So when you've gone a full 12 calendar months from your last period and you haven't had another period, you are clinically defined as being menopausal. And then after that 12-month mark, once you've gone a year, if you have any bleeding, that's considered postmenopausal bleeding. And that needs investigated by a doctor because it's really could be concerning for uterine cancer. That's the one thing you really want to rule out, is that that's a sign and symptom of uterine cancer, or sometimes other GYN cancers like ovarian cancer. So if you have any bleeding after menopause, that should be investigated by a doctor. But what happens is essentially the estrogen will go very low. It'll be less than 30, usually less than 23. I've even seen women with an estrogen level of 0. And then progesterone is always low because they're not ovulating. So progesterone is a hormone that is really mostly for pregnancy, for supporting the lining of the uterus for a possible implantation, supporting the pregnancy in early pregnancy until the placenta really takes over. So progesterone is really a hormone related to mostly pregnancy. And so that will always be low. And so when women make this transition and they have this loss of estrogen, they might experience symptoms, they might not. Some women will complain of hot flashes and night sweats, and that's related to the lack of estrogen. They'll start to notice cognition changes or brain fog, and that's because our brain has estrogen receptors. They're going to notice vaginal dryness, or sometimes they'll complain of pain with intercourse, and that's because the vaginal tissue is very responsive to estrogen. Estrogen is what makes the vagina lubricated. It makes the cells really plump and moist. And so as you lose that, the skin in the vagina, that mucosal membrane becomes very thin. It becomes very sensitive, especially when you lose lubrication. Intercourse can be really painful. And not only that, but it increases the risk of urinary tract infections because the same tissue that's in the vagina is up around the urethra. And so it can cause a lot of sexual dysfunction for women. And then the progesterone can sometimes cause symptoms like bloating. Like a lot of women notice that, the week before their period, but it's also can be calming to the brain. So one of the metabolites of progesterone kind of works as a neurosteroid. So women can start to develop some anxiety. Progesterone is very helpful with sleep. It makes you very sleepy, actually. So it depends. Some women have lots of symptoms and some don't. Now, one thing that I've started to really talk about a lot, and I presented at Metabolic Health Summit talking about this, is estrogen's role in metabolic health, right? Something that we don't necessarily think of a lot, but we have estrogen receptors everywhere, and in our heart, our brain, our bones. So estrogen is very anti-inflammatory. And so when we have a loss of estrogen, we actually start to see different gene transcription in the mitochondria. We start to see more inflammation, essentially, more oxidative stress with loss of estrogen. And the loss of estrogen starts to increase a woman's risk of cardiovascular disease, diabetes and insulin resistance, osteoporosis. And right, these things are diseases that are driven also by inflammation. So depending on what a person's underlying metabolic health is coming into menopause, I think can make a huge impact in not only how she feels and transitions really through this natural stage of life, but I think it really can set her up for what her risk is long-term of developing some of these age-related chronic diseases. Now, a topic we could spend an entire podcast talking about, hormone replacement therapy, is, the question would be, is estrogen replacement helpful at, improving metabolic health? And not a lot of studies, that hasn't been the target of a lot of studies. But what we know is estrogen replacement, when it comes to some of these risks, is much better at prevention than it is at reversal. So the idea with hormone replacement therapy for the right patient is that you should replace it within 5 to 10 years of menopause. So once you've started to hit this transition, that's when you want to start having this discussion with your healthcare provider, if it's something you want to pursue or not, because you kind of have this golden window of opportunity. Once you've passed 10 years past menopause, a lot of damage has been done per se, with the loss of estrogen and increase in inflammation. So then the question is, hormone replacement's kind of its own, topic. And I'm a huge fan of hormone replacement therapy, but what could be other strategies in a woman's, lifestyle repertoire that could be helpful for her? Because like I said, the metabolic health coming into menopause can make a difference for what her risk is and how she feels. So, let's talk about diet, because I see on Instagram, like these menopausal diets, and I think there's a lot of, confusion out there. So when we think about diet, because the loss of estrogen causes metabolic dysregulation and an increase in insulin resistance and an increase in visceral fat deposition, which is the visceral fats, that fat around our organs, then removing things that drive insulin resistance and visceral fat deposition would be helpful from a dietary perspective. And this is where I think intermittent fasting, low carb diets, ketogenic diets could be really helpful for women to combat some of these physiologic changes. I mean, the brutal truth is that you don't tolerate, eating a croissant after menopause like you do when you were 30 or 40 or 20. You don't have the same resilience to stressors, to lack of sleep, to psychological, emotional stress, to carbohydrate stress. You just don't have that same resiliency. When it comes to the other macronutrients like protein and fat, protein is something that's important early in life, but it's even more important as women are going through this menopausal transition, because as we age, we have something called anabolic resistance. And I was just talking about this to a patient today. So the amount of protein that's required to stimulate muscle protein synthesis, because our body is constantly in kind of like a build, breakdown. And if you don't provide it with the correct amount of amino acids, then it will just try to create them and recycle them from somewhere else in the body. I tell patients, if you don't send this, message that you still need your bicep, then, your body might just go use some of those little fibers for, for something else. So protein requirements actually increase as we age. And that's difficult for women to wrap their head around, because I have women that are like, gosh, I'm trying to get a lot of protein, but I can only get 50 grams a day. And a lot of that stems from the fact that they're not prioritizing, meat in the diet, and nutrient-dense animal foods like eggs, beef, salmon, those fatty fishes. So there really has to be a shift of starting to think about prioritizing that protein for them. And that really helps battle. First of all, it provides them satiation, because it's really hard to tell somebody to just eat less calories. It's really hard to do. So it provides them, some control of their appetite and control of the cravings, and reducing the carbohydrates does too. And it doesn't necessarily have to be ketogenic for everybody. I think check what your fasting insulin and glucose and A1C are in your lipid panel. Look at your triglyceride to HDL ratio. And these are things that could help you kind of determine if you should be, just low glycemic or low carb, or maybe you should be, ketogenic. I've diagnosed a lot of menopausal women with pre-diabetes and diabetes, and they had no, idea. It wasn't something they dealt with in their 40s. And now suddenly they're menopausal. And what almost textbook every woman will describe is she'll say, doctor, I am doing the same thing I've been doing for the last 10 years. I'm working out. I'm going to Orange Theory. I'm eating pretty good. And I gained 15 pounds. And it seems like it's all around the midsection. My pants are fitting tight. I had to, this gal today, I had to buy bigger underwear. It was very distressing to her. And that's because the loss of estrogen changes where you store the fat. It changes your mitochondrial health and how you metabolize these foods. And so I just can't stress the importance enough of modifying the diet if needed. It's not going to make your ovaries turn back on and make estrogen again. So that's, that once they're done, they're done. So it won't bring back estrogen. So that's something you have to understand. But other things that are not dietary related. So like I said, stress, if you're dealing with, stress in your relationship or your job sucks, those types of things can really exacerbate. It's like pouring gasoline on this smoldering fire. And then sleep is a huge one. A lot of women will complain of problems with insomnia or lack of sleep related to the loss of the hormones. And if there's somebody that's, having a glass of wine at night to try to fall asleep, and they're sitting on their phone, laying in bed, and the bedroom's too hot, they've got the TV on, all of these things, or they've got some airway issues, maybe it's some undiagnosed sleep apnea. I mean, these are all things that are just like nails in the coffin. And so, I always kind of talk about the 5 pillars, which are like nutrition, movement, sleep, stress, and then our environment. And these are all kind of 5 things to address, at one point or another. But I think nutrition is always a good place to start because it's something that you have, control over. And most people eat more than once a day. It's something you do daily. So it can make an impact, really in a short amount of time. And that's what I want people to hear too, is that, you're not broken. Like I said, 100% of women are going to go through menopause. And there's certainly things you can do. I mean, it depends how motivated you are to make changes. I know that lifestyle change is not easy. We get into these habits and patterns, and those things can be really hard to break.
Yeah, absolutely. I mean, everything you touched on is like, I just think super relevant and things that people might not hear, So one thing you talked about, and I just want to, because I wanted to ask this, but for the blood markers, I think you mentioned 4 of them. Is there like specific number? I know like we don't need to talk about specific numbers, but like there was the triglyceride to HDL ratio. I think that's the one that maybe a little bit less common. Is there like a specific number for that kind of points out, okay, maybe you need to focus a little bit more on like a lower carb approach or keto or whatever?
Yeah. So basically, to review those blood markers, so fasting glucose, we'd like that to be less than 95. Fasting insulin, depends what lab you're checking. Most places are going to say it's normal if it's less than like 17, but I prefer it to be less than 5. You can also calculate an insulin resistance index based on those 2 numbers. Hemoglobin A1C, you want it less than 5.7. Anything over 5.7 to 6.5 is pre-diabetes, and anything over 6.5 is type 2 diabetes. And then when it comes to the lipid panel, everybody always likes to concentrate on like the total cholesterol and the calculated LDL cholesterol. But really, when it comes to insulin resistance, you want to look at this triglyceride level and the HDL, which is the high density lipoprotein. And the triglycerides, the normal number for triglycerides on a standard lipid panel is less than 150. And then HDL, ideally in women, you want it greater than 60. But then you look at the ratio of the triglycerides to HDL. And if you were right at the upper limit of triglycerides, right, let's say they're 150, and then let's say your HDL was 60, you look at that ratio. So it's almost 3 to 1, right? So it's considered normal numbers, but that actually is indicative of some mild insulin resistance. So ideally, you'd like those numbers about 1 to 1. So, triglycerides of 100 and HDL of 100. That's a baller HDL, by the way. So I did a social media post recently, people can go check out, but like my triglycerides are 42 and my HDL is 69. So my ratio is actually less than 1, which is awesome. You do want the triglycerides greater than 40. I'm going to have Dave Feldman here on my podcast coming soon to talk about that. And lower isn't always better. So when we think of most lab markers, anything on the extreme of low or high tends to carry some risk. There's kind of this, target in the middle that we want to go for. But a 1-to-1 ratio is amazing. A 2-to-1 ratio of triglycerides to HDL is probably pretty good. Anything above that, it's a linear relationship with risk, a linear relationship. So if your triglycerides are 3 to 1, 4 to 1, 5 to 1, 10 to 1, that's a linear relationship with risk, with insulin resistance, cardiometabolic disease. So that's something you want to look at. Triglycerides are basically blood fat. So it tells us that your body's working so hard on dealing with the glucose and the insulin that it doesn't even have time to figure out where to put this fat. And what will happen as your triglycerides go up is it will start storing it in the liver, and you'll get fatty liver disease. So that's where insulin resistance and fatty liver disease are related. But you can actually reverse it. And I've seen phenomenal results with patients, pulling that fat back out of the liver, burning those triglycerides, understanding how to be a fat burner again. But that's a marker that you want to look at on the standard lipid panel. And it's easy. It's pretty cheap to check it. And it's something that I think, especially as you get older, is something you should check on an annual basis.
Awesome. Yeah. I think one thing that I do, because this just came to my mind with triglycerides, sometimes people complain or they say like, oh, I started following a ketogenic diet, my triglycerides went up. Now I don't know what to do. Like, do you get that at all with any of your patients?
You can see transient changes on the lipid panel. So it depends how long you've been doing the diet. If you just started the diet and then went into your doctor like the next month, right? That's hard to interpret. You never want a knee-jerk reaction off of one because you want to make sure it's actually a fasted level, right? Where you went in to have the blood drawn. So you want to trend it over time. We don't typically see elevation of triglycerides on a ketogenic diet. So usually in those situations, I think about familial hypertriglyceridemia. So, ask around the family. There could be a family history that's predisposing them to elevations in triglycerides. Almost always across the board, because we have data from Virta Health and other studies that have been done on low carb diets, we almost always see a reduction in triglycerides, an increase in HDL, but sometimes we do see LDL go up. And that's not always a bad thing. It can be a normal response to low carb diets, but if your triglycerides are high, you need some additional investigation because there's definitely risk with that.
Okay. Gotcha. Yeah, that makes sense. Okay. So I want to switch gears a little bit and actually kind of going with the blood work too. So you just had your bodybuilding competition about 2 months ago. So I want to dive into that a little bit. But I do want to talk kind of the transition into that could be talking about like blood work. So did you do blood work like pre-competition, during, post at all?
Yeah. So I did blood work. I started my prep around New Year's. So got some blood work first of the year. Everything looked beautiful. Hormone levels, thyroid. We looked at lipid panel, looked at inflammatory markers, looked at everything, and it looked great. And then we did some post-show labs as well. And then I intermittently checked a few things, probably like 6-8 weeks out from the show. As I really started to feel, kind of run down. I was very interested to see kind of where things were.
Yeah. And were any of the markers like abnormal or anything like that?
Yeah. So when my husband had done this bodybuilding competition the year prior, I checked his labs too. And the one thing I was so amazed with is that, and he honestly made it look really easy. I don't know why it's easier for men. But what I was amazed is that he prepped ketogenic. So, he's eating tons of beef and eggs, and he maintained his thyroid function and he maintained his testosterone levels. Which with most bodybuilders eating a calorically, restricted diet, pretty severely restricted, and then eating low fat, I have seen a lot of both men and women in my clinic with really low testosterone levels, just kind of really wrecking their hormones. And so that's what I was most afraid of, going through this prep. And so for a woman, it's a little bit different, right? Because our biology is a little bit more complex when it comes to ovulation and menstrual cycle. And you always hear about people losing, their period. I did miss one cycle right before the show happened. And so that's when I checked my labs. What was interesting is I didn't cycle, but I still had good levels of estrogen. So I honestly think it was probably just the stress and not necessarily, lack of hormones. But then it came back after the show, after I reverse dieted, but the thyroid levels still all looked good. All the other markers, my lipids looked amazing. My inflammation markers, all of that looked good. And so, my kind of like N of one question going into it was, doing this ketogenic, like, is this a healthier way maybe, for the sport? Because it really is an extreme level of training and dieting and stress on the body. And I don't really have plans for this to be like my professional career per se, but I just wanted to experience it. I wanted to feel it so that I could understand, when I take care of these patients, and my husband wants to compete again. So, I just had a lot of questions, and I do think it's a good approach. I do think it's a good approach for some people. I'm not saying that eating high carb, low fat, I'm not saying it's better, but I think it's a way that you can probably preserve more hormone production. And that's, in my opinion, maybe better. I don't know.
Yeah. Yeah. It is a really, like, I wish there was a way to do like a lot of research on that, but just from like talking to other coaches and just people in that space, it's like the research in general is just hard. Right. And it's like in that realm is really hard because it's like you have to convince people. And I think it might be a cool thing to have for people who are, or a cool thing to experiment with for someone who is like a repetitive competitor. Like this is their literal lifestyle. Like this is their life. In terms of like the hormonal, issues that arise with that. So, but it's hard to also like convince someone to do that, or even convince multiple people to do that for a study. Like it's hard.
Well, I mean, I'm sitting there on show day and I'm like, my nerd brain, I'm like, oh my God, it would be so cool if I could just set up a table and everybody just come by, after the show and let's draw everybody's blood and like, let's look at what average like A1C level, because I think that people on the internet look at these pictures of people. And I will tell you this right now. I feel like I've been pretty dang healthy with a really good body composition for the last 5 years, since I started, I really actually only started lifting weights in 2018. So 4 years of weightlifting and eating high protein and low carb. And I never in my life, once I started posting these pictures of my competition, people are messaging me and they're like, oh my God, what's your secret? What are you doing? Tell me exactly what you're eating. What are your macros? Like, it was like all of a sudden, like the way that I looked was somehow better and healthier than what I had been doing for the last 4 years. And I think that people see these images and think that that's like the ultimate, oh my God, I want to look like that. But I don't think people understand how extreme it is, and that there is a level of healthy body fat percentage and metabolic health that doesn't look like that. And I'm not talking about like healthy obesity, because there are some people that are quote unquote classified as obese and their metabolic markers look great. Now that's probably like 1% of obese people when we look at data, but there is a healthy level of body fat percentage that people would look at a picture and say like, oh, I don't know, like, I'd like to look leaner, and it's been interesting. We have a DEXA machine now at our facility called Upgrade Performance Institute. And you'll see people and they look great. I mean, they look great, and they'll do the DEXA and they're like, I'm disappointed. Like I need to be 15% body fat. Like there's always like, we're never satisfied. And I think when you live with that internal disconnect of like what you are and what you think you want to be, like you're perpetually dissatisfied. And I think it just like feeds this, internal language that like not good enough, I'm not doing the right things. When, I mean, I check labs on people sometimes, they're at a healthy body fat percentage, the labs look good, but they still want to lose this like magical 10 pounds. They still want to look like the girl that did the bodybuilding competition. And so I always say like, well, let's be realistic. Like, what are you willing to sacrifice to look like that? Because I'll tell you what those 6 months were like. And I don't think a lot of people are willing to do that.
Yeah. I mean, I'm not willing to do, I haven't done a bodybuilding competition. I've thought about it many times. I've gotten like photo shoot lean for me, but getting like stage lean and going through the process that you went through, like that is a huge commitment. There's so many sacrifices. There's like what you just said about the psychological component of it. And also realizing that like, that is not like being stage lean is, you can't maintain that. Like that is not healthy or realistic to maintain. And I think people like looking at that and thinking that that's just completely not reality. So maybe we can talk a little bit about like the psychological component, like you said, of going through it. And maybe this is something that, I mean, I've not experienced myself, but I've worked with some people and heard, the aftermath of the competitions and how to go from being your leanest self, right? And, that part of it, and then like the reverse diet out of it. So can you tell us a little bit about like kind of your I want to kind of know your process before and like some of the specifics with the approach, but I want to make sure we hit on the after part. Cause I think that's the piece that people don't think about. They're like, oh, it's the show day. That's it. Okay. Whatever. It's fine. Like it's over, it's done. But like, there's a lot of work that goes into the after part to make sure that you can get back to a healthy place from both physiologically and psychological. So maybe we can chat a little bit about that and your process over the last 2 months.
Yeah. I think that you have to be in the right headspace before you go into something like this. And I was kind of like you, like I never wanted to do anything like this. But then watching my husband do it. And then, like I said, I just wanted to experience it so that I could understand, what my patients are, what they're going through, what they're doing. And it certainly was a level that I had never attempted in my life, right? Like I'm attempting to get to a level of leanness, in my life that I had certainly never been at. And prior to starting prep, like I knew we were going to start January 1st. And my coach wanted to do like a long process. Like he didn't want this to be like an extreme, like 6 weeks, 8 weeks. So we were like, we're going to spread this out, basically like 16 weeks. But then I knew that I have a history of binge eating, not horribly, but like, certainly it's there. It would meet criteria. And so I started to have and watching my husband prep, actually, I had just come off Mrs. America. I was supposed to maybe do a show with him, but because I was competing for Mrs. America, I chose not to. But watching him diet actually created a lot of anxiety for me, like watching him prep and like weigh his food. And I started like eating more calories than I normally would. And so I was worried coming into the prep, what the end game would be like when I came out. And I even started to have some bad behavior, like leading into November and December, like knowing that prep was starting January 1st. I was like, oh my God, I'm never going to be able to like eat this again or eat that again. And so I went a little crazy through the holidays. But then prep started. And honestly, while I was in prep, I loved the regimen of it. Like I basically started at about 2,400 calories on January 1st, because you want to estimate kind of like where you're at for maintenance. And that seemed to be kind of where I was at. And so we started at 2,400 and then we titrated down really honestly, like a couple grams of protein and fat each week, not that many calories. I think people don't understand the level of titration. Basically, you have to weigh your food all the time. And every week it just was like slowly going down in calories. So I started at 2,400 in January, and then I finished close to just under like 1,600, like right before the show. I think like the week of the show, I was maybe at 1,400, but that was for like a couple days. And so, but I liked the fact that it created less decision fatigue for me. Like basically I knew exactly what I was eating. I knew exactly how many minutes of cardio on the stair climber I had to do, knew exactly how I was going to train. And it was just like, wake up and execute. And honestly, it allowed me to expend energy in the decision-making world on like other things. Like I was like writing my book and working on. So that was very interesting to me. Like I actually liked being in prep. It was great. I felt like really in control. Because on most days, right, you come home and you're like, oh, what am I going to eat for dinner? And if you don't have something prepared, then you might just like do something that's convenient. Or because if I'm not training for a show, I'm like, oh, I don't know. I don't feel like working out today. So I honestly liked that part of it. And then the other aspect of the psychology is as you start to look really lean and shredded, right? People are noticing, oh my gosh, your staff in the office is like, what are you doing? And that I think can become a little bit addicting to people. Oh my gosh, you look so good, right? It's just like reinforcement. And like you had kind of mentioned, like when you get to show day, like you look like that for like a day. And, but it doesn't just like magically disappear. Like you still look pretty good, like a week or two after the show, especially like as you're refeeding, like sometimes you even look better than what you did on show day. But basically what happened after show day is then you just start titrating the calories back up. Like you don't just go back to 2,400. Like you don't just go to the buffet and like eat all the food, you just slowly titrate that back up. And that's where most people fail, is during that kind of like refeeding. They're just like, maybe they do it for like a week and then they're like, I'll just eat what I want. I'm tired of measuring and tracking and doing all this stuff. But it's important because your body is very depleted. It's ready for some nutrition. You want to get it back into an anabolic state. But from a psychological perspective, as you kind of see the striations go away, the veins go away, or, whatever you looked like, you feel fluffy. Like you just, you do. Like, I'm just going to be honest with that. And, it kind of starts to mess with you a little bit. You're like, oh, I don't know. Like, maybe I should just stop here. Like, I'll just stay at this, whatever body fat, but kind of depends what your long-term plans are. Like if you're going to compete again, then it's really important. But, I'm back at, over 2,000 calories again. And I feel normal. I feel like I can still be, social. But it's the reverse diet is probably honestly more important than the diet during prep. Yeah. When you're thinking long-term, like this is, you're competing for like one day, but the rest of your life is maybe a little more important.
Yeah, no, exactly. I love how you kind of touched on all of those points. I think something that, like, obviously you were in prep for a specific competition, and like from a mental perspective, it's like, okay, it's go time, like execute. But I think there is, a piece of that can be brought into like someone who's not going on stage, right? Someone who's just looking to just, maybe they're going into a fat loss phase and they're looking to lose whatever, 10 pounds or whatever. They just want to lose some body fat. But there is and I found this with a lot of the clients that I work with, having that regimen, taking out the mental focus of the food and just put it in. And I'm actually in a prep for a video shoot right now. And this is what I've been like, I have my own coach. So I'm like 6 weeks out from that, but I have like been eating the same thing every single day, pretty much for like the last month, 2 months. And I typically eat the same thing every day anyway, maybe varied a little bit. But taking out the thought process of that and just like putting stuff on, like on repeat is so beneficial from the standpoint of, okay, I don't have to think about this. Like you said, I can just execute and I have that consistency in place. And then obviously within, when you're not in prep, you're not, you're doing this to still maintain some type of lifestyle, because obviously in prep, there's a lot of sacrifices that you have to make. But working in those, like, okay, if I'm going to be on point Monday through Friday, where a lot of people get into the issue is like, okay, I'm going to be on point Monday through Friday, and then Saturday, Sunday, I'm just going to go crazy. Then we start to get into like that cycle, which is an issue. But if you can find that balance where, like for me, for example, I'm regimented Monday through Saturday at lunch, and then I have like a nice dinner Saturday, and then I'm right back on it Sunday. That works for my lifestyle, but it's all about finding kind of like what works within your lifestyle. And so I think that's super important. Also with the psychological component of coming out of the prep, like you're 2 months out right now, right?
Yeah. 2 months.
Yeah. Okay. So with bringing calories back up, can we just talk a little bit more about like the importance of making sure that you aren't staying at that like the lower end of that? Because what a lot of people think is like, oh, I'm just gonna, diet down, and once I get to my goal, even if it's not like a prep goal, I'll be there and I'll be at that calorie intake. But yeah, you could sustain that, but that's not going to be sustainable for the long term. So in terms of like working your calories back up, can we just talk a little bit about why doing that will lead to putting on some weight? Like there's no way around that, but you can still sustain some part of it, right? Like it's not like you're just going to gain all the weight back that you lost, but you can get to that point where it is like you're going back to that 2,000, maybe 2,200. Maybe we can't get all the way back to 2,400, because if you lost, how many pounds did you lose?
Yeah, so basically I started my prep at like 179 pounds. And then the day I left for the show, which I don't know actually because I was out of town, I had to travel, I had to fly. So I didn't have like my home scale. So it was really hard to know like what my weight was the day of the show, but I was like 147 probably. Okay. So what is that? Like 30 some pounds. I'm currently sitting like around 160, 162, and I'm back at maintenance calories. So like, I'm not back up at 179, and I'll probably, kind of chill around here. The interesting thing is the coach that prepped me for the bodybuilding competition also helped me prep for Mrs. America, which obviously I didn't want to be like as lean for that. But I had these like side-by-side spreadsheets of when we did it. And I had put on some muscle after Mrs. America. Like once all the pageant stuff was done, right? I got back in the gym, was like lifting really hard, and I still lifted really hard during my prep. But because I had more muscle mass, if you looked side by side at like where my weight was the year prior and where my weight was the year during prep, I actually got to eat more calories, but I was at a lower weight. So what's the important thing you need to hear is that if you do it the right way, over time, you can actually maintain a lower weight and still be able to eat more food. So it was like, I got ready, did my thing in 2021, and then I did this in 2022. And I think that, like if I were to do it again, I think you can get to that level, not easier, but I think, once your body has that metabolic flexibility and you're doing it the right way, you can go down and come back up and go down and come back up. But I think sometimes people, try to chronically diet and they don't address all the other things like sleep and stress. And they're just chronically, depleted, nutrient depleted, calorically depleted. It can be really hard to like just push the gas pedal harder. So, I think there's a right way to do it. And it's, yeah.
And last thing to just kind of point out with what you mentioned too, there's also a factor of like the coming back to this like psychological side of things, like being in a dieting mindset. Like we hear about this, or at least I have worked with a lot of clients they're like, I've been dieting for the past 3 years, right? Like they're in this dieting restrictive mindset, but they psychologically are in that mindset, but then physically they haven't been in a deficit, right? But there is like this disconnect between feeling like you're always restricting, you're always on a diet, and then actually being in a deficit. And so, like you said, you can't chronically restrict both from a physiological, but also a psychological standpoint, because that is just going to lead to cycles of binging and yo-yoing and always feeling like you're dieting when, it might feel like you're dieting if you're on point for a few days and then you don't track the 3 scoops of peanut butter you had at midnight one night, right? And then those things add up and add up and add up. And so like you're always in this dieting mindset. I think that's super important what you mentioned. Like you can't always be in this restrictive cycle. You have to be, I call it kind of the restrictive versus abundance, right? Like we need to get to that abundance where you're at maintenance, around maintenance. You're focusing on like all the things that you need to feel good, because being in a deficit is a stress on your body already. And so that plus the psychological component, like if you're not doing this properly, if you don't have a coach, I mean, I've had a coach for the last 4 years just because I think
coaches.
Exactly. Coaches need coaches. You're a coach. You have a coach. Yeah. It's like, you shouldn't be going about this on your own if you really, especially if you've struggled with it in the past. And then also if you want to get to your goals as efficiently as possible, you need that outside perspective because things can get rough. So yeah, I'm glad that you shared all of that. Is there anything else that you had, like any major takeaways that you had from like the full process of the competition that you want to share?
You were saying like you're prepping because you're, going to do a shoot or something like that. I don't think people have to compete to, do an endeavor like this. My husband, actually, the first year he did it was 2020 and the pandemic hit and his show got canceled. Well, like it doesn't mean that he didn't do an awesome freaking job. So he took some pictures and immortalized it and then reverse dieted. And, from a psychological aspect, I mean, I killed it. I killed my prep. I did everything I was supposed to do. I felt and looked like I wanted to. And then I went in there and on show day, you're looking around like, oh no, like I'm the rookie here, like straight up novice. Like these people look incredible. And like you immediately start playing the comparison game. Like, oh, I didn't do enough. I should have done 20 more minutes on the stair climber. And that's really hard. And so to be quite honest, like, unless you love the competition, and everybody says like, it's you against you out there. Like, no, like I'm a competitor, like I want to win.
Yeah.
And that can really play mind games with you in the sport too, because it's really honestly very subjective. Like it's very subjective what they're looking at and how they determine, the scoring and who wins. And But it's hard not to take it as a message, if you don't place or you don't do well, that like you did something wrong, like because your genetics are your genetics. I mean, the way your body looks and responds and how big your lats are and, XYZ, like these are things that are, somewhat out of your control. So I'd be a huge fan of somebody who just wanted to, try it just to see what they could do, and it's really about saying what you want to do and then just honoring your word and executing. I mean, that's the simple thing.
Yeah. No, I love that. And I think, and that's like, I work with a lot of clients, especially in my group coaching membership right now. It's called the Flex Fam. And like, none of these ladies are looking to compete, at least from what I know. I'm not looking to compete, but I always tell them like when you look good, and you feel good, that builds your confidence for everything else. So like, there's nothing wrong with going into a fat loss phase and doing, something that, is hard, right? And you're getting something out of it from a physical standpoint. A lot of people talk about like, oh, you shouldn't focus on, how you look and whatever. But I mean, I want to look good because when I look good, I feel good. And then I perform so much better in every other aspect of my life because I have that confidence, right?
Yeah. It's kind of like when people will message me and say like, what do you think about breast implants? Or, like, what do you like? I'm like, if you want purple hair and you want breast implants or whatever, because that is going to bring a version of you to the world that provides energy. And if that makes you the best human possible, I don't care, So if you think that you're a better human at 15% body fat and you understand what it takes to be at 15% body fat and maintain that, do it. Right. But if there's some internal turmoil with how you look and feel, now obviously this can become pathologic, right? Body dysmorphia and whatnot. But I think that you have to, say who you are and honor your word and don't give up.
Yeah. I love that. Well, I think we should end there because that was awesome. Thank you so much for spending the time. I'm glad that we kind of hit on two kind of, all the topics go into each other with nutrition and fitness, but I think there was like two separate topics there.
I don't know. There was like this 80-something-year-old woman that was competing at.
Oh, really?
You can compete after your menopausal, ladies. There was like plenty of master class, which of course I don't feel like I'm that old and I competed in masters, but you can do anything at any year of your life. So
I love that. Awesome. Well, do you want to just tell our listeners or viewers where they can find you? Anything exciting that you have coming up? Anything like that?
Yeah, you can find me on social media, Dr. Fit and Fabulous on Facebook, Instagram, Twitter, YouTube, all the things. I've got a podcast called the Fit and Fabulous Podcast, and Rachel's been on there. So you can go check out that episode. But later this summer, I have a book coming out called Hard to Kill, which is basically a little bit about my story and these 5 pillars that I talk about and what I feel like are basic, simple ways to be hard to kill, essentially, the way you eat and move and stress and sleep. And there's also going to be a Hard to Kill Academy that goes along with it that people can, join online and challenges and things like that. So I'm super excited about that. And it'll be coming out later this summer. If you go on my socials, you can sign up for the wait list for that.
Awesome. Super exciting. I will link all of that in the show notes. And then is the Hard to Kill Summit is coming up in August too, right?
Yeah. So formerly it was Keto Summit Omaha. We've rebranded to be a little bit more all-encompassing, that it's not just about diet. These other lifestyle factors are super important. So we want to bring in, just a little bit of broader range of speakers for people. And that'll be in Omaha, August 18th and 19th. So if you want to get tickets for that, I've got a link also on my socials. And we've got a Facebook page for that too. So yeah.
Awesome. I'm bummed because that's literally when my video shoot is. That was like the one conference that I wanted to go to this year. And of course I couldn't. No. So I'll have to be there next year.
We'll make it happen. Yeah.
Awesome. All right. Well, go deliver some babies, and I appreciate your time, and hopefully we'll have you on for a 4th round in a few months, maybe.
Love it. Thanks, Rachel. Appreciate you.
Well, all right. Talk to you soon.